Hello, 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 hello. We are here again.
I know.
Another Friday, a little bit late. Sorry, guys.
Sorry about that.
Luckily, we post this and you can watch it later. So, today with Morgan, we are talking about women and addiction. It is National Addiction Week, or Treatment Week. And tomorrow is National Take Back Day. And there are posts all over the internet of where you can find somewhere to take your medications back to if so need be. So, women and addiction. What do you think? Let me change that. What are some things that women could maybe potentially be addicted to that maybe they're not necessarily aware that they're addicted to, or that they maybe don't realize it's an addiction?
Right. So I think we're all kind of aware now that there's an opioid problem in our country, and opioids we'll talk about for a minute, because I think opioids kind of set the stage for what addiction and dependence look like. And I think that one of the things that happened with opioids was that the crisis actually arose largely out of a prescribing problem. So in the early 2000s, we started thinking about pain as something that should have a measurable response of 0. So people should not have pain. If we think about your pain scale, 0 to 10, 0 being nothing, and 10 being, I want to rip my fingernails out because it hurts so bad, like horrible
Hurt less.
Horrible pain. We think that we were given a misimpression that the pain level should always be 0, and if it's not, then we need to do something to make it 0. And so we increased the prescription of opioids in the United States, and as a result, ended up triggering a lot of addictive response to opioids, particularly in women who develop dependence and addiction much more rapidly than men do, with a lower degree of exposure. And part of that's metabolic, part of that's their hormonal state, part of that's what happens with their brain chemistry in response to those particular substances. So any substance that increases or alters dopamine in somebody's brain, that's a brain chemical. It's a neurotransmitter. It's something that's in people's brains and regulates mood, and it also regulates how their body responds to things. Any substance that impacts dopamine is potentially a substance on which somebody could become dependent. Now, when we talk about addiction, we think about addiction as like a particular set of behaviors, right? So we think about people who are addicted as being like socially unwell, right? Like we think about people doing things that are considered social faux pas. We think about people feeling, we think about, behaviors, in particular what we see on the news with the opioid crisis. We think about like the people in Seattle under the bridge, and we think about that as addiction. That is one face of addiction, but the bigger face of addiction looks like people who may or may not even know that there's a problem. They're not necessarily illicitly obtaining something. They might still be using a prescription that somebody's provided for them, and they might just find, like, I feel pretty bad if I don't take that.
And like you or I.
Yeah, and especially as pertains to the opioid crisis, actually most people who have dependence on opioids, most women who have dependence on opioids are middle to high income people who have jobs, who are functional, who receive a prescription from their provider, and they don't illicitly obtain the substance. They take the prescription as prescribed, and if they miss a pill, they feel horrible and they need to get that pill in. So opioids are certainly one thing that people could become addicted to, but any medication or substance that's altering what's happening in the brain is something that somebody could potentially become dependent on. So other things that people could become dependent on or addicted to. And there is a little bit of a difference between a dependence and an addiction, in that a dependence is something where somebody has to take something or they're going to feel particularly bad. An addiction is more like if you don't have it, or if you don't have the access to it, you're going to have a system of how to get it. So for instance, I'm addicted to coffee. I have a coffee addiction. It's both a dependence because it causes some physical symptoms in me. So if I don't have coffee, I feel pretty crappy. I get a headache, I feel lethargic, I just don't, my body doesn't feel right. And that's because every day I drink coffee, and so my body has come to expect that every day I will have that coffee and I will have caffeine. And if I go camping, for instance, I know if I don't have coffee, I'm gonna feel bad. If I go camping and I have to change the way that my coffee gets made, or I might not have the things that I need to make the coffee, before I go camping, will set up a whole system of what I need to do, including maybe taking caffeine supplements in order to not feel bad. That's the addiction. So the addiction is the stuff, that the extent to which I will go through a whole different process in order to make sure I'm not having the dependence symptoms or the withdrawal from that particular substance. So coffee, we think of as like, that's not a social problem, right? Like everywhere you can go and get coffee. Like I can go to Starbucks on every block, or I can stop at an espresso shack at every block, but it's kind of the same process. It just doesn't, like I wouldn't kill somebody for coffee, right? Like I would, but you know, if I felt worse, right, I might. So it kind of depends on what that dependence and withdrawal looks like. Like if I were getting really seriously sick and could not get up because I needed my substance, I might engage in behaviors that were more problematic potentially. Does that make sense?
Yeah, I mean, it definitely does. And I can see how it can be such a very fine line of confusion because they are so very similar in some aspects, yet so very different in others. So if anybody has questions about any of that, please don't hesitate to call us for one. What are some opioids that you find are most commonly used to kind of satisfy that addiction?
Prescription opioids?
Let's start with prescription.
So if somebody has a dependence on an opioid, often it's because they got some Vicodin in the ER, or they were given Vicodin by a provider because of some pain that they were having, or they took somebody's Vicodin, which is part of what the medication take-back is. They took somebody's leftover Vicodin because somebody had some Vicodin from a surgery that they had, or they had their teeth pulled, and then they found that created a euphoria in them that they wanted to have. So that often triggers the dopamine release in the brain. And then for women, even a short course of being exposed to something like Vicodin could potentially trigger them to have a dependence or an addiction. So Vicodin, oxycodone, Percocet, those prescription Dilaudid, those prescription opioids are things that people could potentially become both dependent on and addicted to. And then sometimes that turns into a use of illicit substances. So things like I can't buy it on, I can't get a prescription from a provider anymore because they're refusing to give it to me. I'm feeling really badly. Now I need to go and use something else. And for some people that will turn into a use of something like heroin, or you could sometimes purchase illicit pills on the street. So sometimes people have those leftover pills, the things that should have been taken back, but they had gotten them. Or there are some people who will go and get prescriptions not to take for themselves, but to actually distribute to other people who do have an addiction. And then people are buying it by the pill on the street or from a friend or wherever. And the same is true of medications that are used to treat opioid addiction. So methadone and Suboxone are things that people can also sometimes illicitly obtain just to make themselves not have that withdrawal. So, and you had asked before, and I didn't completely answer the question, but anything that alters somebody's brain chemistry or changes the substances that are released in the brain in response to that substance is something that could potentially become addictive. So, and we talk about marijuana as being not an addictive substance, but because it is a psychoactive substance, it does have addictive properties, and people can become dependent on marijuana where they're feeling like, I actually can't go more than a day without smoking marijuana, or I don't feel right. Mm-hmm. If you can't go more than a day without doing something and you're thinking about it all the time, if you are thinking about the thing, and it might be even food, if you are thinking about the thing all the time and it's occupying a lot of your mental space, there is a potential that that thing is an addictive substance. And this is a fine line, right? Because there are all kinds of things that we think about. Like we think about shopping on Amazon. We think about having sex, we think about all kinds of things. But if it's taking up an inordinate amount of time and interfering with your ability to do other things, there is a chance that that is an addictive situation for you. So things like alcohol, marijuana, nicotine, opioids, certainly both prescribed and illicit. Anxiety medications can cause this to happen for people because of how it changes brain chemistry. Any kind of stimulant, food, sugar is definitely an addictive substance, especially for some people who have a difference in how their brain chemistry responds to that sugar. So sugar increases your dopamine circulation. For some people, that triggers an addiction. We know that there are genetic precursors to addiction too, and to dependence, that there are certain people who, let's say you take an opioid and you're like, that just makes me throw up. I take an opioid and I'm like, this makes me feel great. There's a difference in how our brains respond to it, and that in me, I might be more susceptible to develop an addiction to a particular substance, or in you, you might be more susceptible to developing an addiction to a different substance. For instance, you might like to smoke cigarettes, and I might like to take Adderall. And it just feels differently in our bodies, but it's not an addiction until I'm thinking a lot about it. So where I say I have an addiction to coffee, which is a stimulant, I have an addiction to coffee, it's partly because of my dependence, right? It is because of my dependence. I like the way coffee makes me feel. I don't like the way I feel when I don't have coffee. So I'm dependent on it because I want to have the feeling that I have when I've had my coffee. And that leads to the addictive behavior of thinking a lot about it if I don't have access to it. And the first thing that I do every morning when I wake up, the first thing that I do is hit the button on my coffee grinder. I walk out into the kitchen, I grind my coffee, and I make my coffee. And if that gets disrupted, I'm pretty crabby about it. Like, I'm pretty irritated that I didn't get my coffee, and I'm thinking a lot about what I'm going to do instead to get it. So for people who have, for instance, an alcohol addiction, sometimes they will wake up and the first thing that they're thinking about is the drink that they're going to have. Like, when am I going to have a drink? And can I have one right now? And how many hours until it's like socially acceptable for me to do that? And if I just have a little bit right now, probably that's okay. And it becomes kind of this like slippery slope of now I'm drinking more than I should have been drinking. Now I'm having to drink in order to get through my day. Now I'm like going out of my way to hide the drinking, or I'm rationalizing why I'm drinking, and it's starting to interfere with my ability to do other things because my thoughts about drinking and my attempts to obtain the alcohol or ensure that I have alcohol available are now interfering with my ability to do other things, or I'm finding ways to have to integrate it into my day. Does that make sense?
Yeah, and it kind of brought up, excuse me, something that you and I have talked about before when it comes to addiction, and this week bringing some attention to it. How with addiction, it being a slippery slope because, and you kind of mentioned it with the coffee, right? Like, not so much that like I maybe need to have the coffee, it's the fear of what will happen if I don't have the coffee. And I know we've talked kind of extensively about this just in, within our work day. And, like for me with sugar specifically, when it was like, or coffee, like I'm not addicted to coffee. I just know that I'll feel bad, and I don't want to feel bad if I don't have my coffee. So I drink my coffee preventatively, and that being kind of a slippery slope of, do I actually need the coffee, or am I afraid of what will happen if I don't have the coffee? And that's something kind of, if there's anything, that's something that you and I have talked about that really helped me understand addiction better, as far as, not just like, oh, someone's addicted to pills, so they just take pills all day long because who knows why, or it being, oh, they're taking a pill because they're afraid of how they'll feel if they don't take the pill. And I know you specifically can help a lot of patients with I'm drawing a blank on what it's called, the medication-assisted therapy.
Medication-assisted treatment.
Or treatment, excuse me. So if someone is addicted to something and they're wanting to reach out and find a resource to help alleviate that from their life, if not completely eliminate it, what advice would you give them, or how would you present to them that we have resources that can help with that?
Yeah, I mean, I think that it has to start with motivation to change, right? And as you were talking, I was thinking about my addiction to coffee, which is something that we can kind of just talk about, right? Because there's no stigma to it. So there's no feeling that I have about telling you, like, I gotta have a coffee, because nobody's making me feel badly about it, right? Like, there's no social ill attached to my drinking coffee. Nobody cares whether I drink coffee or not. If it were something where I was having to sneak around to drink the coffee because somebody was judging me for drinking coffee, I might be less likely to come out and say, hey, I feel like hell when I don't have this.
Right.
And I think a lot about it. If my routine gets screwed up and I don't start my day by having it.
Also, most people have that same.
Right, socially acceptable. It's a socially acceptable situation where nothing is impairing me necessarily. So I'm not ending up being weird or unable to take care of my children, or like the effect that coffee has on me doesn't impact my ability to function.
Right.
Whereas some of the other substances that could become addictive are both harmful to our health, nicotine, or like the vaping that, a lot of the e-cig companies presented that as like the healthy alternative to smoking, and what we've realized is that actually it's just as addictive, if not more, and potentially as dangerous, if not more, than consuming the tobacco in the first place, because it does different things to our lungs, but it definitely has those addictive qualities. The way that it was presented was like, this is the healthy version of smoking, right? So everybody should just do it. So if there's something that's harming your health and you're doing it despite knowing that it's harming your health because you can't stop it, then that's more problematic, I think, than drinking something like coffee. But the same is true for things like addictions to sugar, right? Like people who have addictions to sugar or food addictions or something that's really going to interfere with their health and well-being, probably, and we have to acknowledge that, right? Because it's not socially unacceptable to eat gummy bears. Right? Like, it's not. People eat gummy bears, people eat ice cream, people enjoy food. The only thing is when it becomes something where it's impacting somebody's health to a degree that is potentially problematic, it should probably be addressed. It is harder to walk into an office and say, I'm addicted to something that you could potentially be judged for. So even though there's like fatism in America, right? Like, people don't want to talk about their food, and people don't want to talk about like, oh, I'm eating like 6 candy bars in one sitting because I can't stop eating it because it's like delicious. I'm like hiding it around the house. My husband won't see it. Like, there is some guilt and shame attached to that. And that's something that is hard for women to come in and talk about. Heroin's even harder. Like, heroin is even harder because that is like, I might lose my kids. Nobody lost their child over cake.
Right.
So I think it's a hard thing when or even alcohol, like, you may feel bad coming in and telling me that you have a food addiction or a sugar addiction, or that you'd like to stop drinking coffee because you'd like to not be dependent on it. That might feel bad to you, but it's a totally different kind of bad when you're coming in and telling me that you can't stop drinking alcohol, because then there's a whole other layer of stuff that gets added onto it, like driving and keeping your job, and nobody ever lost their job over a cookie, So I think that a lot of the social stigma is something that has to be unraveled first, and makes it really hard for women to admit to themselves and to their loved ones and to their providers that, hey, maybe I do have something going on with it. And they don't really have a safe space to acknowledge that because it has been so stigmatized, which is part of what's happened with the opioid epidemic. People don't feel like they can come forward and say, ooh, I'm having this happen and I need some help.
So what's something that we could, inform people that, you've accepted it and you want to change it? How can we, as, associated with healthcare, how can we present to them? Like, you can reach out to us, you can come without fear, other than, obviously we can say, no judgment, no, you don't need to be afraid, just come reach out to us. But maybe somebody who's watching has a friend who has, instead of being like, hey, watch this Facebook Live, like, how can we inform others to how would you reach out to somebody, I guess, if you've noticed that somebody is wanting to make a change, but they don't know where to start?
Like, how would you tell your friend?
Yeah, if they've kind of said like, I don't want to do this anymore.
Mm-hmm.
How can we?
Well, I think knowing what those resources are, right? So I think another issue is a lot of addiction treatment has been relegated to like mental health, right? So it's been relegated to like, you have to go and see a psychiatrist, or you have to go and see like the specialist in addiction specialist, or you have to go to like a chemical dependency center in order to get treated. And there's a stigma with that, right? Like there's a stigma in just walking through the doors, like, I don't want to be like these people, or I'm not that kind of person who does that. When really, in reality, the kind of person who has an addiction is you and me, right? Mm-hmm. Like the kind of person who has an addiction is taking care of their kids, and they're going to work, and they just have another thing that they have to do during the day in order to make themselves functional. But we have a whole societal stigma around it. So if you came to me and you said, hey, look, I think I have this problem, I'm not really sure what to do. If I didn't know that there was another resource available, I'd be like, oh, maybe you're supposed to go to a recovery place. And then you'd be like, but I'm not like a junkie because I go to work every day. And it makes it almost inaccessible. So I think having a resource to say, hey, there's a provider who takes care of everything. And I wish that every provider would do training for addiction treatment, because it is a part of healthcare. It is a part of people's lives. It is just like heart disease, something that's affecting people. And right now, at least with the opioid epidemic, it's affecting way more people and killing way more people than cancer or heart disease or high blood pressure, anything that we're routinely treating in medicine. And yet there are providers who say, ooh, I don't want to train in that because that's like, I don't know what kind of patient that is. But it's also, if you have a provider who's doing addiction treatment, they're thinking differently about all of their approach to your healthcare, because they understand the brain chemistry and how other things have addiction potential other than just opioids, or, you know, as we think of them, like illicit substances.
Yeah.
So I think if you were referring a patient, if you were referring a friend to get help, maybe just letting them know that there are providers in normal clinics who are committed to treating addiction and who have resources that are available for that treatment.
And it's a safe space to go. And I mean, I think that's one of the most important things, is making sure people know that when you reach out to a clinic or a provider who can help you walk that road, it's a safe space. It's, you know, no judgment.
And non-punitive.
Yeah.
I think that a lot of what stops people is fear around what's going to happen if they do disclose this. Right. Am I then going to get in trouble at work? Am I then going to lose my driver's license? Am I then going to have to tell my husband who I don't tell because I don't really want him to know that this is happening for me? Like, how many people are going to find out when I seek care for this? Right. And I think that's a deterrent for a lot of women, is I don't really want this to be public knowledge. So I think having that confidence in the provider that this stays here, and really it's being treated as any other health condition. So you come in and you have a vaginal infection, we treat your vaginal infection. We don't go tell your boss. Right. You come in and you have an addiction, we treat your addiction, because
and we don't go tell your boss.
We don't go tell your boss. Because that's what you came in for. Right. And you have a headache, we treat your headache. And I don't think that it should really be separated, because I think it does people a disservice when it is.
Yeah, agreed. So with that being said, sorry we were late today. Unfortunately, we have to cut this Facebook Live a little bit shorter than most of them. We've got more patients to see in the clinic today. If you have any questions about anything we talked about addiction, about your drug take back, anything, please do not hesitate to reach out. You know where to find us. Chinn LLC, Mount Vernon. But reach out, come see us. We're here all the time. Enjoy your company and
have a great weekend.
Have a great weekend. Enjoy your Friday. And if we don't, enjoy Halloween. We won't see you before Halloween. So,
yes, we will.
Halloween's on Thursday.
Oh, we won't on Facebook Live.
Happy Halloween.
And Dr. Chinn will be doing next week's Facebook Live.
On It's Express. See you then.